Signs of ovulation. When do you ovulate? Most fertile days. We are talking about the signs of ovulation. When do you ovulate? Finding your most fertile days. By the end of this video, you will be able to know the signs of ovulation, when do you ovulate, and how to find your most fertile days. Without further ado, we shall begin by a diagram of the reproductive system. The whole of this part is what we call the ovary. It is lined by small follicles. These follicles contain what we call the egg cells. The eggs are the ones which are released, and then they go on to be actually fertilized. And when they are fertilized in this particular part of the fallopian tube, they become what we call a zygote, and then this fertilized egg or the zygote travels through the fallopian tube until it attaches onto the uterine lining. When attachment has taken place, it begins forming, it begins growing into an embryo, and this can always be seen on ultrasound scan very easily. But in today's video, remember, we are talking about the signs of ovulation, and the first sign of ovulation is that there's going to be increased discharge coming from your private parts. This normally is, it looks like egg white. This discharge, it's normally thick. In most cases, it may be thin in some women, but this discharge normally increases on the 14th day or around the 14th day. The next sign is that there's going to be increase in your body temperature. The temperature will begin by dropping, that is before your ovulation date, but it actually increases just after ovulation. So it is also very advisable that if you are trying to get pregnant and you begin seeing these signs, it is very important to be with your partner. The other sign of ovulation is that you can actually feel pain. It's also known as the Mittelschmerz pain, or German, that is a German word for middle pelvic pain. So this pain normally is due to the egg being released from actually the ovary. So the other thing is that there's some little bleeding. The other sign is that there can be some little bleeding in some women. Not all women feel this. So in summary, there's pain which is around your pelvic region or around your waist. It may be one-sided. The next is that there's increased discharge coming from your private parts. The other is that your body temperature may tend to increase, and normally this is after ovulation. So the other thing we shall need to talk about is, when do you ovulate? We are answering the next question, which is saying, when do you ovulate? So before we answer this question, we shall look at a typical 28-day menstrual cycle. This is basically an example, assuming that this particular client went into her periods for at least a period for at least 7 days in total. You realize that when she saw her periods on 1st, 2nd, 3rd, 4th, 6th, 7th, when she saw her periods from day 1 up to day 7, normally we said that this is when you cannot get pregnant, because even if you see your periods for 2 days or 3 days, normally the first 6 to 7 days, there are decreased chances of you getting pregnant. So in this particular client, when she saw her periods for all these days, of course, these were the days when she was least fertile. There's no way she could get pregnant. So the whole of this phase normally means there's shedding of your endometrial wall taking place, also known as menstruation. The next period is from day 7th, we go to day 8th and day 9th. Here, it is very, very possible for you to get pregnant, depending on your age, depending on some other factors, for example, your hormonal levels. So this is also known as the follicular phase, where the follicles or the eggs are beginning to form slowly. So the other thing is that if at all you are on medication for fertility, there are high chances that even within this period you can actually get pregnant. The main reason is that these drugs or these fertility drugs quicken the maturation of the eggs. Next is the ovulation period, or the most fertile window. Normally this is calculated by counting 14 days from the first day you saw your period. So when you count 14 days, normally this is going to fall around here, and this is a place, this is an area, or these are the days when there's increased chances of you getting pregnant. So even after ovulation, because remember we talked about ovulation as the release of the egg, and normally this happens on the 14th day, but it can also vary depending on your cycle. So even after ovulation, after the egg has been released, it is very, very possible for you to get pregnant. But also, if you do not get pregnant during these days, then what happens is that there's going to be thickening of your uterine lining. Your uterine lining is that lining, it's the walls of your uterus, so they begin thickening. And the main reason why they thicken is that after you have got pregnant, the hormones estrogen and progesterone tend to increase, and then they increase basically because they are preparing to receive the fertilized egg. It's an automatic process which happens. But if at all it happens that you were not pregnant, or you did not get pregnant during this period of ovulation, then much as there's thickening during this phase, also known as the luteal phase. The first phase is the follicular, when the eggs are growing, and then the next phase is the luteal phase. So if there's no pregnancy that has taken place during the ovulation period, then what is going to happen is that the hormones we talked about, the hormones include estrogen and progesterone, they are going to drop. When these hormones drop, the estrogen, progesterone, and even the luteinizing hormone, when they drop just because you have not got pregnant, then the endometrial wall, or the inside of your uterus, is going to begin shedding, and that shedding is what we call menstruation. So to answer the next question, which was asking when do you ovulate, normally depending on your cycle, we have taken this as a 28-day cycle. This is basically an example, but depending on your cycle, normally around the 14th day, around the 11th, 12th, 13th, and 14th day, that is when you are ovulating. But this normally depends on how long your cycle is. So to answer the question, when do you ovulate? It's normally on the 14th day. The signs of ovulation, we have talked about them. Next is the most fertile days. How can you find your most fertile days? We have said that to find your most fertile days, you just have to count from the first day you saw your periods, and then on the 14th day, that's when you are going to be able actually to ovulate. And we said that ovulation is the release of the egg, the mature egg, also known as the Graafian follicle. So in this video, we have talked about the signs of ovulation. We have talked about when do you ovulate, and then your most fertile days. So let me know if you have any questions in regards to what we've talked about, the signs of ovulation, when do you ovulate, and your most fertile days. Let me know if you have any questions. Keep watching. I've got lots of messages for you. After this advert, we are going to continue with our video. Keep watching. The Ovulation Calendar, Get Pregnant Faster, the complete guide. Ovulation Calendar, Get Pregnant Faster, the complete guide. This is my new ebook. It talks about ovulation. It talks about all the rules you need to follow, everything you need to follow if you are looking at getting pregnant. Get your ebook right now. Order for it on my WhatsApp. You can send me a message. It is +256 701 797876. You could also send me a WhatsApp on my other number. It is +256 787 668 962. Order by email. Also, you can send me an email on ovulationebook@gmail.com. That is ovulation ebook at gmail.com. Get your ebook right now. If you are looking at getting pregnant, you will read it. There are lots of steps to follow. They are easy to understand. Get this ebook right now. It goes for only $20. Order for your ebook at only $20. Send me a message and I will show you how you can purchase your ebook. When you get this ebook, you'll be able to determine ovulation. You will understand the common problems with ovulation, the common drugs for ovulation, and then also you'll be able to improve male fertility, because you may be thinking that you have issues when there are issues with your partner, when maybe he has issues with low sperm count, poor sperm quality. So I talk about all this in this ebook, and then also you'll be able to determine, you'll also be able to have sex, and then of course to determine gender selection. You'll be able to time sex for gender selection, and then also you'll be able to have all your questions answered about ovulation. Get this ebook right now, because the biggest problem most women seem to have with getting pregnant is determining when they are ovulating, and then their most fertile time to be pregnant. In this ebook, I've got all this covered. Just order for your ebook today, and you will be able to know, you'll be able to begin on this journey of getting pregnant very easily, knowing that you have a guide, you have a book you are reading, and it's giving you tried and tested information which has worked for many women. It has worked for many couples. Get your ebook right now. To order, send me a message on +256 701 7978 and 76. That is +256 701 7978 76. You could also send me a WhatsApp on my number. It's also +256 787 668 962. Send me a message showing your interest, and I will show you how to order for your ebook, how you can purchase it. It will be delivered straight to your email once you submit all the details, and then also you could send me an email on ovulationebook@gmail.com. Get your ebook right now. Ovulation Calendar, Get Pregnant Faster, the complete guide. It goes for only $20. Gerard Massa, the health educator, are my names, and please connect with me and you'll be able to get this ebook. Have yourself a fantastic and healthy day. Bye bye. So thanks a lot, my friend, for watching our videos. I hope you've learned something. Let me know in the comments what you've learned. Remember to hit the subscribe button for new videos I put out every day. You learn a lot about ovulation, how to get pregnant naturally. So remember to get your book, your ebook I've just released, and please let me know if you have any questions in my WhatsApp. Talk to me on my WhatsApp and we shall discuss more. Subscribe so that you watch new videos. My WhatsApp numbers are +256 701 797876 and +256 787 668 962. Connect with me, ask me all your questions, and I will answer all your questions. May God bless and protect us all, and see you in my next video. Remember to read the description for details. I've got lots of information for you.